Alright, this is the upper extremity test. So I'd first start out by inspecting the skin. I would look for dryness or scaling, and I'd check for temperature of the skin. Then I would go and look at, I'd do trophic assessment of the appendages and the skin. Then I would check for skin and nail color of his hands. So I would do the compression test of the nail beds, and I'd check for clubbing as well, making sure that the color rushes back into the fingernails. And I would also check for clubbing, which could be indicative of cardiopulmonary disease. Then I would check the hydration test, and I would basically check for tissue changes in the skin of the hand. Then I would go to pulse check, and I'd use 2 or 3 fingers, and I would check the pulse first off radial, and I would check for amplitude and rhythm and rate. So I'd check radial, and then I'd go underneath and I'd check ulnar, which is more difficult than the radial to find. Alright, and then I would move on to brachial. So I have the patient flex the bicep and go in the middle of it, and here's good. Check brachial as well. And then I'd move on to Allen's test, so I'll have the patient do this. And then I'll grab here and cut off both radial and ulnar and then release. And check ulnar. That's so I'm going to do it again. And then down here, and then release. And then I'll check radial. And that's much quicker. And so now I'll check for nodes. So I'll check the epitrochlear node initially. So the patient's elbow is supposed to be flexed at 90 degrees. And I palpate in between the bicep and the tricep, more towards the armpit, or kind of in the middle there for lymph nodes. And I just feel for any just to check and see if it's swollen or anything. So first I check, and then I'm going to move on to checking lymph nodes. And I would check for anterior lymph node, or the pectoral region. Just basically for tenderness or swelling, or if there's like a hard rice-sized lymph node in there. And then I would check the lateral lymph node, just in the armpit, and have the patient relax their arm. And then I check for the medial. And then I check for the posterior, which would be the humeral, the apical, and the subscapular. And that does it for the upper extremity test.